So I'm Michelle Lonsdale. I'm one of the specialist practice nurses. Am I allowed to say working at North Thoresby practice?
And so if you could sort of give us a brief experience of your Whzan journey, maybe.
I mean, obviously when we first started it, it was a little bit slow. Um, from that, after a little bit of a slow burner with it in the beginning, it's been brilliant, if I'm honest. I've found the experience with it really, really good. Um, I guess the main thing for us is that we can kind of oversee what is going on at the care home without being there, I suppose. Every month they do regular observations now. So I can sort of click on and off whenever I need to. With that, I've highlighted on quite a few occasions that we've had patients with oxygen saturations that are maybe too low, and then sort of rang the home and can we do these? We've highlighted patients with hypertension because blood pressures have been really high. And then on the flip side of that, people with low blood pressures where we've needed to sort of titrate the medications down. Um, so I've found the experience with it really, really good. It takes me a few minutes. I can sort of click on, have a little look, and I can sort of look through them and think, oh, that wasn't like that last time, and then I can contact the home. But yeah, so I've found it really, really, really useful.
Good, good, good. Now it may be you, it may be me, but you're breaking up a bit, and I don't know if it's my internet or your internet. So I'm hoping I'm not missing too much. So if I ask you something that you've already asked, it's because I've not heard it. If that makes sense.
Yeah.
So I know you mentioned briefly some outcomes for residents. Have you got any specific, again, without mentioning any names, any specific outcomes for any residents where it's affected their care and had a better outcome for the resident themselves?
We've had we've had a few occasions really where we've identified things before it's kind of got to it. We had a lady with a really, really, really high blood pressure. And we that that particular lady, we managed to start on some medications quite quickly.
Do you think that medication prevented her maybe going to hospital, or do you think it's that?
Oh, yeah, no, absolutely. So I think her blood pressure was, yeah, significantly out of range. With a lot of these patients, it's quite difficult as well. In a normal sort of realm of healthcare, we would obviously ask them to wear a 24-hour holter and we would have a look at what the blood pressure's doing that way. A lot of the patients in this particular care home have got advanced dementia. So as you can imagine, wearing a 24-hour holter would not be suitable for a lot of these patients. They would just pull it off. So we did blood pressures morning and night over 5 days, and it highlighted that the blood pressure was significantly high. So we managed to start her on some medications quite quickly, and we brought that blood pressure right down. Now the lady's doing absolutely amazing. So we had another lady who again would been showing some really sort of aggressive behaviour. And when we did her blood pressures again, her blood pressures were significantly high. So we had a sort of play about with her, not play about her medications. And then the girls were saying that after we had done that, from identifying through the Whzan, that her behaviour had significantly changed. Again, because these patients have got advanced dementia, it's very difficult to sort of, identify what the causes are. And a lot of the times it has been sort of related to observations. Whether it be, again, another one, like I said to you earlier, we identified a man literally within the last couple of weeks who we were doing his oxygen saturations. He was well in himself. He was eating, drinking, not showing any signs of any chest infections. He is known COPD patient. So we knew that his observations could be low. However, we got some urgent bloods done and the blood's come back, and we had to admit him to hospital, actually, this one particular patient. And they found out that he's got reoccurrence of a cancer again. So it's, you know, that maybe would have gone missed because he was well in himself, you know. It was just the fact that obviously observations had changed a little bit, which initiated some urgent bloods.
It's amazing.
Yeah. So obviously, I thought that was absolutely fantastic. And now he's back first and they're going to monitor him going forward. But that could have been missed for quite some
Yeah.
time.
So you caught that early and it's got that early prevention. That's really good.
Yeah.
Um, do you think your relationship with the staff in the home has changed through using this, or do you think, or was that just a stupid question?
No, I think definitely. I think the whole thing really. I think the staff feel more supported because of it. Like I said, even if they don't understand the readings are there for us to review. So, like I said, if I notice something, I'll ring them up and just say, I've got Mrs. X. This doesn't look quite right to me. Could you repeat the observations? And I think it's just about, like, again, it's about us reviewing the information, isn't it? And being able um to highlight that through
Do you
there,
think,
which,
I'm interrupting.
yeah.
Do you think the staff are getting more conscious of what the readings are now? Are they being more inquisitive and getting used to what's normal and what's not normal for certain people?
Yeah, I think more recently, um, we they will ring us up and say, "Oh, we've done this. What do you think to it?" Or, can you just have a look at Whzan for me? So it's definitely coming on. I think what I would like to do with the staff now is get them to use some of the other facilities a little bit more.
Just while I've got you, do you know if the home discusses with the family members of residents, or the family members none the wiser in terms of remote monitoring, or do they just assume that observations happen as a matter of course?
I wouldn't I wouldn't assume that the families know. Mainly because, if I'm honest, not a lot of families go into that particular home. Um, so I think that's just most probably something that they feel that they just do. To be honest, as well, when I have been in, if family members are in there, I will sort of sit and speak to the family members. So I will say to them, we come in every week and that the weights are done and the obs. So some will know, but maybe not all of them.
And lastly, if you could sum up Wizan in one sentence, could you do that for me, please?
Oh, that's a difficult one, isn't it? Um, I think it promotes faster patient care, really. Yeah, I think it's more timely patient care. Um, we can act more quickly.
You think it's a good thing in the long term?
I absolutely love it. Yeah, I do. Yeah, no, I just think it saves time. We're not having to go into the care home all the time to check observations. Because I'll just say to the girls, well, could you take me some observations and I'll have a look at them,
That's the
if
way it
they're
should be.
worried, if they're worried about a patient. Um, and then I can kind of think, right, okay, well, the observations are fine. So, we don't need to rush. Keep an eye on the patient, give them all the sort of red flag advice. Because at the end of the day, they're in a 24-hour care facility. So, that it can be managed really well that way. Um, we've definitely noticed a reduction in hospital admissions and ambulance call outs as well. Those they've gone right down from where they were, a year ago.
It's really, really, really good. So yeah, that's just to say thank you very much for your time. I hope it hasn't been too painful on their Monday mornings. It's been a pleasure to see you again.
Yeah, yeah, it's been good. But yeah, I like I said, I love it, Sean. I do think it's great. So, I'm an advocate for it.
Well, thank you very much. Thank you for your time. Have a good day and see you again soon.
Okay.
Hopefully.
Thank
Been a
you.
pleasure.
Bye-bye.
Bye,
Bye.
Michelle.